Good afternoon, friends. This is Dr. Anoop Dhamangaonkar. I am a visiting joint replacement consultant and orthopedic surgeon at SL Raheja Hospital. And as we stand on the cusp of celebrating World Arthritis Day on the 12th of October, I decided that why not celebrate defeating World Arthritis Day? So defeating arthritis. That's the crux of my talk today. We are all into the eighth month of this pandemic, and thanks to this, we are still working and surviving. So I hope to continue the same. I advise all my young friends, all the people watching this video, to continue taking these precautions. As we are into the eighth month, we are looking at some lifestyle changes, the new normal as we are calling it to be. The new normal is going to see most of us working from home, more time being spent at home, less time outside, less amount of outdoor activities, leading to a more sedentary lifestyle. So, as an aftermath of this pandemic, I am already seeing an increase in your musculoskeletal issues and joint pains. So, coming to the topic of what is arthritis, let's understand what is the normal gross structure of any joint. So, any joint is basically an articulation of two bones, which are the ends of which are covered by an articular cartilage. That's a smooth covering over the bone ends, which are then lined by the synovial tissue, which secretes the lubricating fluid. This leads to seamless, frictionless, pain-free range of motion in normal joints. Now, in arthritis, what happens is you have got degeneration of the ends of the bones. That is, the articular cartilage wears out, leaving the bare bones open. So each time you weight bear, you move your joint, it leads to eburnation of the bone, leading to inflammation, which ends up as pain, swelling, stiffness, and decreased range of motion. So these are the four things that you need to keep in mind, which will be repeated as time goes by. So if you have got pain, stiffness, swelling, or decreased range of motion, it's a kind of matter of self-diagnosis that you are suffering from some kind of arthritis. Now, when we talk of arthritis, it's of different types. So, the primary osteoarthritis, that's the substantial portion of patients that we see, is because of pure wear and tear. The second type of arthritis comes with a family of inflammatory disorders. Now, this type is through chronic autoimmune disorders in which the body's autoimmune system or immune system generates antibodies against its own cells, namely rheumatoid arthritis, संधिवात जिसे बोलते हैं. So that is inflammatory arthritis. So rheumatoid arthritis, in which you have got small joint involvement, morning stiffness, then ankylosing spondylitis, which leads to decreased range of motion and stiffness in your back and your large joints. Then you have got lupus arthritis in SLE patients. Then you have got psoriatic arthropathy, which is associated with skin lesions. There's also a specific type of gouty arthritis is because of increased deposits of uric acid in your joints. Now, most of these conditions can be tapered by medicines which modulate your immune response, and therefore the initial flares of these autoimmune disorders can be controlled. Mind you, steroids is an important part of autoimmune disorders. Also, in COVID treatment, steroids are absolutely important in certain situations. Keep in mind, steroids definitely affect or improve your autoimmune response, but they do affect the blood circulation to your hip joints, which leads to a vascular necrosis of your hip and secondary arthritis of the hip joint. I guess we are seeing a large number of these patients now, and this number would set to rise because of this pandemic. So keep a watch on your hip joints and your range of motion if you are on steroids. The second type of secondary arthritis is your post-traumatic. If you have any kind of fractures which involve the joints and this fracture is neglected or is reduced in a malposition, it can lead to eburnation of the articular cartilage and enhance your wear, therefore predisposing to arthritis. The third type of secondary arthritis is post-infectious. So if you have any infection into the joint, अगर कुछ भी जीवाणु जंतु हो, and if you have got infection and involvement of your joint, it can eat away into your articular cartilage, which can increase your wear and lead to arthritis. So take home messages: if you have got any kind of infection and fractures into your joint in spite of this pandemic, please consult your doctor, because that is going to affect the rest of your life, the mobility in the rest of your life. Okay, so now we come on to the main part of patients that we see, which is pure osteoarthrosis, that is wear and tear of your joints. It's like having a new shoe and running 4 or 5 marathons, your sole is going to wear out. That's the kind of wear that we would see in the joints if we are especially into high flexion, deep flexion activities, if you are leading a sedentary lifestyle. So that would increase the wear on the joint. So how do we manage, prevent, or treat these initial cases of arthritis that we see. So first and foremost is exercise. I guess we must have had a focus on exercises. Yeah, vyayam, varjish ke prakar karna to everybody must be knowing by now. So we should focus on exercise. This is a single most important preventive and early management strategy that we should adopt, come what may. In spite of medicine, without medicine, with surgery, without surgery, exercises are a paramount thing to manage your arthritis. So what exercises are we looking at? We'll mainly stress upon strengthening your thigh muscles. So that is basically strengthening your quadriceps, your hamstrings, so that your knee is unloaded. Now, the rationale for this unloading is what we say is if you have got strong muscles, your body weight is basically transmitted across the joint rather than only loading your joint. So this is a partial unloading of your joint that basically helps in regenerating your articular cartilage, prevents your wear and delays your arthritis. So focus on quadriceps and hamstring stretching exercises, strengthening exercises. Walking is paramount. So as far as recommendations go, 150 minutes of walking every week or 30 minutes of walk every day is important, not only for your heart, but even for your joints. So that will prevent your joint stiffness as well. So focus on exercise. Secondly is what diet should you follow? Of course, diets which have less of trans fat, less of saturated fatty acids are absolutely important and to be avoided. Avoid any kind of processed food, cheesy materials, sugars, because they also increase inflammation apart from increasing weight. Okay, so what things are preferred is any citrus fruits or vitamin C rich foods are actually preferred. Vitamin D rich sources like salmon or cod liver oil are recommended. Berries are good to eat. Tofu is good to eat. So all these are good things that you need to have, which especially contain omega 3 fatty acids. That's basically decreasing your inflammation. Body weight reduction is paramount because that has proven scientifically to decrease or delay your arthritis. So BMI less than 25 after age of 30, 35 is absolutely important, and bear in mind that. So what medicines do we treat or what medicine do we give if you are suffering from pain, swelling, joint stiffness and decreased range of motion? So that is if you are early symptoms of arthritis, what do you do? First is avoid deep flexion activity. So avoid sitting cross-legged, avoid squatting for as much as 2 to 3 weeks. Apply ice as soon as possible because that is going to decrease your inflammation. Medicines, what we advise are in two parts. The first part is basically to decrease your pain and inflammation. That is for about 4 to 5 days. The next part of medicines are basically supplements that we give are chondro supplements, which are, for example, glucosaminoglycans, hyaluronic acid, curcumin, which is a turmeric derivative, then boswellia, rosehip extract, undenatured collagen type 2. All these are new products that have come up, which are chondro supplements. Now, all these are substances that are present in your articular cartilage and are meant to enhance their healing. So, all these are supplements that we usually give to delay the progress of your arthritis. Now, what if the progress of arthritis is to such an extent that the patient is disabled? Mind you, is disabled by activities of daily living not being performed. Patient is dependent on medicines for a long time. Patient is dependent on others to lead a healthy lifestyle or even activities of daily living. Or the patient is suffering from such a medical condition that he cannot take medicines. Now, in this situation, the life or the quality of life of such patients is pretty bad. I guess that is the time when we prefer to operate. Now, operation, what we consider is joint preserving when we consider redirectional osteotomies or cartilage procedures, or in severe cases, we go in for a joint replacement surgery. Now, joint replacements over a period of time have really evolved over a period of time. So, we do partial knee replacements, that is, only the worn out compartments are basically replaced, or in patients who have got significant deformity, laxity, are obese, have got multiple compartment involvement, we do a total knee replacement. So regarding the revolutions that have occurred in the field of joint replacements, we now do it through a minimal invasive approach. We have a fast track protocol in which most of my patients usually go home the next day of surgery. That is decreasing cost. This is scientifically proven, decreasing cost, decreasing chances of cross infection. Patients are adherent to a better physiotherapy protocol once they are at home and at their own residence. So that is the kind of change that we have adopted. Thirdly, ceramics, that is the bearings that have come up, have revolutionized joint replacement in a big way. Ceramics were introduced for joint replacement surgeries for the hip initially, which have increased the longevity of the joints. Similarly, now, previously we used to do for knee replacements, cobalt and chrome metal on tibial tray. That is the articulation that we used to follow. But now we have got ceramic coated implants for the knee as well. That is zirconium nitride, oxenium, that is a gold knee, or niobium coated knees that have come up. So these knees are usually preferred for patients who are young, arthritic, and require a joint replacement, or with patients with metal allergy. So we have got implants now which have increased longevity and revolutionized the way the patients live. So especially when we are having this vicious cycle of patients with severe arthritis, who fall into the cycle of increased pain, therefore they cannot move, which increase their weight, increase their mental depression, increase their dependence on others. It is important to break this vicious cycle, and then for an ideal option, that is a joint replacement, enabling the patients to actually get back to their life in a very independent, pain-free way of life. So I guess that is what is more important. So the take-home message is, if you are any kind of pain that is unrelenting, if you are dependent on others, definitely we have a good option, that is a knee replacement, which we can assure, or a joint replacement surgery that we can assure the patient of a pain-free, normal way of life that can actually last them for decades. So we at Raheja Hospital now are quite open and welcoming our non-COVID patients as well. We have got separate entry and exits for our non-COVID patients. We have got state-of-the-art facility in our OTs, our wards. Patients are being sanitized, screened for all our non-COVID patients. Even the doctors, the staff are maintaining absolute hygienic precautions to keep it COVID safe. And we have had a very good response as far as patients coming here for non-COVID treatments as well. So I would really encourage you to self-judge your condition. It's not very difficult to know if you are having or suffering from arthritis. Please do not ignore. I think that is one take-home message that I would like to give. Please do not ignore your condition, because ignorance now is going to affect many decades of your life further on. So please consult your doctor. We at Raheja Hospital are pretty much open for our consulting. Our theaters, our operations are pretty much on. And I hope to see you, a healthy you, in the coming years to come. And I hope we can defeat not only arthritis, but COVID as well. Okay, so let's not just add years to our life. It's important that we infuse life into those years. I really thank you and appreciate you for this hearing today, this afternoon. Wish you very, very, very good health. Thank you.